Hello, I'm April and I'm going to be your student nurse today. Would you please tell me your full name
Kagan right now.
and your date of birth
4/11/1991.
and today's date?
4/17/2021.
Okay. Do you use any tobacco products?
I do.
What do you use and for how long?
Smokeless tobacco for about 15 years.
Okay. Do you drink alcohol?
No.
Use any illicit drugs?
No.
Do you have any history of cardiovascular, neurological, respiratory issues?
No.
Do you have any allergies?
No, not that I'm aware of.
Okay. All right. So Mr. Knapp is dressed neat and clean. He's freshly showered. His skin has a good color. He seems alert and cooperative, and that we are going to be able to do this head-to-toe assessment. So we're going to begin with the face, head, and neck. Okay, Mr. Knapp, I'm going to begin by inspecting and palpating your scalp. I want to make sure there's not any lice, dandruff, lumps, lesions, any abnormal-looking moles. His hair is clean. He has a nice thick head of hair, not dry or brittle. Okay. I don't feel anything out of the ordinary. Use my pen light, just double check and make sure I don't see anything. Okay, absent of dandruff or lice. Thank you very much. Okay, what I'm going to do now is test a couple of your cranial nerves, the trigeminal nerve. I am going to put my hands on the side of your jaw. If you'll please open and close. Any popping, cracking?
Nope.
I don't hear anything. No crepitus. You'll please shift your jaw from left to right. Great. Now I'm going to test the facial nerve. If you will please let me know if you feel this.
Yep.
Feel this?
Yep.
Will you please smile? Thank you very much. Okay, I'm going to now palpate your temporal arteries. Those are equal bilaterally. I'm going to now palpate your carotid arteries, which we never do at the same time. Okay. Now I'm going to palpate your frontal and your maxillary sinuses. Please let me know if you have any pain or tenderness.
Nope.
Okay. Nothing feels swollen. Pain or tenderness in the maxillary?
Nope.
Okay. All right, now I'm going to palpate your lymph nodes. So we're going to start with the pre-auricular, which are in front of your ears. Please let me know if you have any pain or tenderness.
Nope.
Okay, no swelling. Post-auricular, pain or tenderness.
Nope.
Occipital, pain or tenderness.
Nope.
Okay. Submandibular, pain or tenderness.
Nope.
All right. Subluminal, pain or tenderness.
Nope.
All right. Supraclavicular, pain or tenderness.
Nope.
All right, great. Now we're going to test the range of motion of your neck. If you'll please tilt your head all the way back. Okay, put your chin to your chest. Turn your head to the left, and your head to the right. Touch your ear to your shoulder. Both sides, please. All right, looks like you have full range of motion of your neck. Now I'm going to have you shrug your shoulders. This is testing cranial nerve 11. All right, good strength in the shoulders. And that completes the head, face, and neck assessment. We're now going to begin the eye assessment on Mr. Knapp. We're just going to examine the overall structure of your eyes. It looks good, no swelling, any tenderness.
Nope.
Okay, clear, no redness in the eyes. Okay, now we're going to do some vision test, okay? I would like to actually just put your eyelids down and check your conjunctiva and your sclera, if you'll please. Okay, pink and moist, great. Now we're going to do, like I said, some vision tests. If you'll please cover your left eye, and if you'll read this.
Red, blue, green.
Okay, and if you'll cover your right eye and read this page.
Blue, green, and red.
Great. Okay. Now, you'll please let me know when you see my finger.
See it?
Okay? Just this side. Let me know when you see my finger.
See it?
Great. Okay. All right. Now, we are going to, if you'll please cover your left eye and tell me how many fingers I'm holding up.
2, 3, 2, 1.
And you'll cover your right eye, please.
2, 3, 4, 1.
Great job. Okay. Now I'm going to test your 6 cardinal fields of gaze. Would you please follow my pen light, okay?
Okay.
Great job. All right, now we're going to test your reaction to light. Please look out in that direction. Put the pen light. Great. Okay. Now, if you would look out there, let your pupils adjust. Okay. I'm going to come in again. Check the other. All right. Pupils are equal and reactive to light. Now, if you will please just Follow my pen light. Great. Everything went well with the eye examination. Okay, Mr. Knapp, we are now going to begin your ear examination, okay? So I'm going to pull your pen up and back. I'm going to inspect the ear, palpate the ear. I don't feel any swelling, don't see any moles or any lumps or lesions. I'm just going to look down in here. A little bit of cerumen, no redness. Tympanic membrane looks healthy. And the cone of light is present at 5 o'clock. Do you have any hearing issues?
No.
Okay, good. I'm going to come over here and assess the left ear. Pull the pen up and back. Examine, palpate the ear. No moles, no lumps, lesions. Okay. Now, let's see. A little bit of cerumen, no redness. Tympanic membrane looks healthy. The cone of light is present at 7 o'clock. No hearing issues on that side either?
No.
Okay. All right. Now, I'm going to perform what we call a whisper test. So I'm going to start out about right here. I'm going to whisper. If you'll cover your left ear and repeat what I say, okay?
5, 6.
Okay.
1, 2, 3.
Great. All right. Cover your right ear. Okay. And repeat after me.
ABC. 1, 2, 3.
Great job. And that completes the ear assessment. Okay, we are going to begin the nose assessment on Mr. Knapp. Just gonna check up in here. Clear, pink. Okay, septum is midline. Any history of any nasal surgeries or anything like that?
Nope.
Okay, everything looks good there. Now I'm going to have you close your eyes and I'm going to bring something towards your nose. Please let me know when you smell it and what it is, okay?
That's not.
And what is it?
Coffee?
Yes. Yes. Okay, and that completes the nose examination. I do want to note that I checked the patency of the nares. Both are clear and there's no issues or blockages or anything in the nares. Okay, we're now going to begin the mouth assessment of Mr. Knapp. If you would please open your mouth wide, I'm going to come in and inspect with my pen light. Okay. Mucosa's pink. I don't see any growths, lumps, lesions. Teeth are clean. Let's see. Gums look pink and healthy. Lips are pink and moist. If you'll please stick your tongue out and say ah. Okay. Cranial nerves intact. And if you'll please do that again so I can check your tonsils and your uvula. All right, your tonsils are present. Everything looks good in there. Okay. Now I'm going to test another cranial nerve. If you will please swallow. Great. Okay. And if you will stick your tongue out and move it to the left to right. Great. Okay. Now will you please say light, tight, dynamite?
Light, tight, dynamite.
Okay. All cranial nerves are intact and that completes the mouth assessment. Hi, I'm here today to tell you how to do a self-breast examination. Now, these should be done around the same time of every month, and if your exam is going to coincide with your menstrual period, it should be done around the 4th or 7th day, and if you are postmenopausal, then you can do it any time of the month, but you should try to do it the same time each month. Now, to begin, you should have your top off, and you should be standing in front of a mirror, and just arms down to your side, look in the mirror, inspect your breast for color, symmetry, any discoloration, any nipple retraction, dimpling. Just see how the breasts look and make note of anything. Now, inspect them with your arms to your side, arms above your head, and on your hips leaning forward. Just get all angles of the breast. Now, for the actual examination part, you are going to use the pads of 3 fingers, and you're going to go in a vertical motion and make sure you cover the entire breast, starting at the axilla and going down to the bra line, and just up and down, palpating, inspecting, seeing if you can feel any lumps, nodules, any abnormalities, and then repeat that on the opposite breast. So you use your right hand for your left breast and your left hand for your right breast, and also do an examination with one arm above your head on each side. And then for the final step of the self-breast examination, take your thumb and your forefinger and squeeze the nipple and see if you have any discharge. If so, you need to note the color, the consistency, and any details about that, including the amount. This concludes the instructions on the monthly self breast examination. So we're now going to begin the thoracic, back, and lungs examination on Mr. Knapp. So I'm going to lift your shirt, Mr. Knapp, and I'll take care of that for you, but I'm going to listen, auscultate the 4 lobes that I can hear from the back, okay? This up here. Okay. Now if you will please, sure I got this on. Take a deep breath. Let it help. Deep breath. Deep breath. Deep breath. Okay. Deep breath. Okay. Everything sounds good there. Now I'm going to examine your spine. Please let me know if you have any pain or tenderness.
No.
Okay. Now I'm going to test your chest expansion. You'll take a deep breath in. Out. Okay, everything looks good there. Alrighty, now if you will please turn around on the chair, I'm going to auscultate the 5 lobes that I can hear from the front, okay?
Okay.
Deep breath. Okay. Deep breath. Okay. Deep breath. Deep breath. Okay. Deep breath. Okay, thank you very much. And that completes the thoracic, back, and lungs assessment. Okay, we're now going to begin the cardio assessment on Mr. Knapp. I just want to inspect your nails. Now, we did check these earlier and they're clean and well kept, but I'm going to test the capillary refill now. And he has no clubbing. Nails are pink. Return is very brisk. All right, now, want to check your left hand, please? Again, very brisk return. Nails are pink and well kept, okay? Now, I'm going to check your skin turgor. Let me flip your arm over here. See. Okay. All right. Skin turgor is good. Doesn't seem to be dehydrated or anything. The skin snaps back easily. I'd like to note that Mr. Knapp has 2 tattoos on the right arm and 3 tattoos on the left arm. Okay. Now I'm going to auscultate your heart sounds. And I would like to, again, lift your shirt. Okay. Okay, we're going to auscultate the aortic, angle of Lewis, second intercostal space. I can hear the lub dub, the S2 being louder, the dub. Okay, pulmonic. Again, can hear the lub dub. Okay. See, go down to about the third intercostal space. Auscultate Erb's point. Come down here to the tricuspid. And the 5th intercostal space at the mid clavicular line, the apical, the mitral valve, the apical pulse. Okay, everything sounds good there. Now I'm going to see if I can actually palpate your PMI, which is your point of maximal impulse. And I was able to hear the S1 sound on the mitral and the tricuspid, okay? Okay, now let's see here. Okay, now I was able to feel the apical pulse there, okay? Which is also the point of maximal impulse, the PMI. Now we are going to palpate for the peripheral pulses, the brachial, radial, femoral, popliteal, tibial, and dorsalis pedis, okay? All right, so we're gonna start with your peripheral pulses. I'm gonna check up here for your brachial. Okay, I was able to get the brachial pulse. Come down here to the radial pulse. Great, that one's good and strong. Okay. All right, there's those two. And again, I already got the apical pulse. Now I'm going to do the femoral pulse. If you please just stand up. Let's see if I can get your femoral pulse. Okay, femoral pulse is there. Now the popliteal pulse. I'm going to go behind your knee here. Okay, you can have a seat.
Okay.
Just straighten your leg out, please. Okay, we found the popliteal pulse. Now we're going to do the posterior tibial pulse. That's over here behind your ankle. Okay, and the dorsalis pedis, which is up here on the top of your foot. Okay, I was able to palpate all of the pulses. Okay, we are back again with Mr. Knapp for his abdominal assessment. Okay, Mr. Knapp, I'm just going to pull your shirt up here. Going to inspect. Stomach is symmetrical. I don't see any lumps, lesions, any weird moles. See any distension. Okay, everything looks good. Symmetrical. Round contour. Okay, now what I'm going to do is auscultate for vowel sounds, all 4 quadrants, okay? When we start down in the right lower and go up this way, okay? Normoactive vowel sounds. Okay, now we're going to percuss all 4 quadrants. Oh, hear that colonic bubble. Alrighty. Now I'm going to do light and deep palpation, just check for any masses. Let me know if you feel any pain or tenderness. Okay, we'll do the light first.
Okay.
A little ticklish. Okay, now we're going to do a deeper palpation, okay?
All right.
Please let me know if you have any pain or tenderness.
No. No pain, no tenderness.
All right. And that completes the abdominal assessment. The lower extremity assessment. Legs are symmetrical. No edema. Hairs evenly distributed throughout the legs. Okay. Any pain, tenderness?
Nope.
Okay. All right. That completes the lower extremity examination. Okay, we're now going to begin the neuromuscular part of the assessment. Now, Mr. Knapp, what I would like you to do is answer a couple questions for me. What did you have for breakfast?
A couple sausage biscuits.
Okay, and what was your first car?
Ford Ranger.
Okay, now I'm going to tell you 4 words, and later in the assessment, I'm going to ask you to repeat those words, okay?
Okay.
Let's do Maxwell, cow, tractor, and farm. Okay, got that? All right, good deal. Now, I would like you to stand up, and I'm going to check the range of motion of your spine. We already checked the neck earlier in the head, face, and neck assessment, and I'm going to check the range of motion of all your extremities. If you'll please bend over and touch your toes. Okay, now lean back as far as you can. Okay, now to the left and the right. Okay, now I'm going to come over here, and if you'll just bend over again, I'm going to check your spine. Any pain or tenderness?
Nope.
Okay, feels good and straight. No lordosis, kyphosis, or scoliosis present. Okay, now if you will lift your arms above your head. Okay, now bring them back down. And if you'll have a seat. lift each of your legs individually. Okay. Bring your legs together. Adduction. All right. Separate as far as you can. Abduction. Okay. And if you'll cross your ankles. Other way. Good deal. Range of motion looks good in all extremities. Actually, just check your wrist to give me a little. Wrist looks good. Okay. All right. I'm going to go ahead and assess your hand grip all right here. Just, okay. Equal bilaterally. Okay. Now, I am going to test your sensation. If you will please close your eyes and hold out your hands palm up. Tell me if this is sharp or dull.
Dull.
Okay. Sharp or dull.
Sharp.
Okay. Again.
Dull.
Again.
Sharp.
Okay. Good. Now, if you'll close your eyes again, I am going to check and see if you can identify what is in the palm of your hand. Okay? Please tell me what that is.
Cotton ball.
Okay. And in your left hand.
Quarter.
Okay. Alrighty. And then in your right hand.
Cotton ball.
Okay. In your left hand.
Cotton ball.
Okay. Good deal. Okay. Now, I am going to have you do tandem walking. If you'll please walk to me, one foot in front of the other, heel to toe. Good. Balance looks good. Okay. Alrighty, I'm going to turn around and go back. Thank you. Thank you. Now, if you'll stand up and with your eyes open, stand on one leg. Close your eyes. On one leg still, please. Okay, good. Really good balance. Okay, now if you'll have a seat, I'm going to have you do a little test where you touch every finger to your thumb back and forth. Okay? And now your left hand, please. Great. Everything looks good there. Do you remember those 4 words that I told you earlier?
Maxwell, cow, tractor, and farm.
Great. Okay. Now, I would like you to put your finger to your nose and then touch my finger.
Okay.
Okay, in the right hand. Good deal. Okay, good job, good job. All right, now if you'll take your right heel and run it down your left shin, and then your left heel down your right shin. Okay, great. Now I'm going to test your deep tendon reflexes now, okay? So I'm going to start over here on the left side, and we're going to start with the tricep. Okay, you'll just let your arm hang. Okay. Okay, not much of a reaction there. If I had an actual reflex tool as opposed to a wooden spoon, we might have a better reaction, but I'm going to try one more time. A little bit of a reaction there. Okay, now we're going to do the bicep. Okay. Not much of a reaction there either. Okay, now I'm going to do your brachioradialis. Okay. Okay, a little bit of a reaction there. All right, now I'm going to do your patellar reflex. I feel like, okay, got a good jerk there. Now your Achilles is going to be a little more difficult for me to get to, but let's see. Okay, +2 reaction. Okay, now over here we're going to do the tricep deep tendon reflex again. I can feel that muscle in there. Okay, good, +2. Now we're going to do the bicep again. Feel the muscle. Okay. +2. All right, and the brachioradialis. +2, good. All right, patellar. Good, +2. Now, let's see if we can get that Achilles down here on the right side. All right, that one's a little diminished, but that is a difficult spot to find. Okay, well, I believe that completes our neuromuscular assessment. Mr. Knapp has been a great patient, and I really appreciate your cooperation. Thank you.
You're welcome.